Hi, everyone. Today I'm going to talk about something that a lot of us neurodivergent folks are impacted by, and that is chronic health. And I really want to talk about the intersectionality between chronic health, chronic illness, neurodivergence, and something that I have had to learn to do, which is learning to advocate a lot for myself in different medical settings, but especially hospitals. One thing that recently came to me was that I'd never really identified as someone with chronic health issues. And even saying that out loud now seems really strange because objectively, I've lived a really medical life from when I was a baby to now. I've had more than 50 surgeries and procedures. To be honest, it's a lot more. I stopped counting at 50, so the number's much higher. I use medical equipment every day. Uh, I just to do ordinary everyday things that all humans do. I pay for because I use medical equipment. I live with pain every day. Pain is just a part of my life. That's not to say that I'm used to it. It's not to say it's okay, but it is a part of my everyday life, as it is for so many people that I know. My body is very different. My anatomy is different. My life has always included hospitals. It's always included procedures. And this kind of medical unpredictability is something that some people only really experience during a crisis. But yet I didn't see myself as chronically ill. And to be honest, I still partly don't. And only recently did dawn on me that actually I do have chronic health issues. This isn't the whole story. It's not even the headline of my story, but it is a significant thread that's woven throughout my whole life and through everything and through a part of my daily life. Finding language for my body has been really, really important, and it really highlights the importance of language and terminology, and being able to identify something in order to feel empowered and to better understand yourself and advocate for what you really need. Um, and part of this shift came when I realized that my strange, mismatched collection of medical issues probably fits under a criteria of Ehlers-Danlos syndrome. Now, I'm not looking for that diagnosis. I'm not chasing labels, as some people might say. But this realization did give me something that I didn't expect, and it gave me some solace. It made me realize that there is a pattern here, and that my body started to make a bit more sense to me. Um, so sometimes naming it and having language around it can be so empowering, and it can really create a sense of relief for us. Well, it certainly did for me. Um, the way I was raised shaped a lot of my approach and perspective around my chronic health issues. My mum raised me to believe that nothing about my physical health was ever going to stop me from doing anything. And she didn't just say it, she lived it. And I believed her. And in so many ways, I still do. Um, Now, don't get me wrong, there were plenty of things that I couldn't do, and there's still plenty of things that I can't do to this day. But I've never framed it that way. Instead, I made it my mission to prove the doctors wrong. Um, and often I have proved the doctors wrong. Um, and then other times they've been right. But the point is, I never saw myself as sick. I saw myself as someone who kept going. Um, I was told I wouldn't be able to have children, and don't get me wrong, there were lots of complexities. But I have three children, which I'm incredibly lucky. I was told that I couldn't do certain sports or I couldn't live a certain way, and I have been able to do that. But there are definitely times in my life where my health has stopped me doing things. There's been terrifying moments. I nearly died from MRSA as a child. I've had so many painful procedures without sedation because it simply wasn't offered at that time. I distinctly remember telling a doctor when I was quite young, don't do anything without telling me first. And she didn't listen. And when she did something, and I didn't mean to do this, I ended up kicking her. And this wasn't out of aggression, but it was out of shock and this complete disbelief and this feeling of betrayal that I'd advocated for myself and I wasn't heard. There were things that I did that, as a child, I think ways that I coped to make that medical world less frightening. When I had lots of feeding tubes, I'd pretend the supplement going through the tube was pizza or burgers. My mum decorated my hospital bed. For those of you who remember Elf, the TV show, I had a big Elf poster behind my bed. I loved Elf. Hospital school was such a lovely spot and place and safe place to be. And it's probably one of the reasons I ended up in the field that I'm in now. Thinking about that doctor and what I did, no one deserves to be hurt in their workplace. I'm not excusing what I did, and I feel so guilty about that. But I was in survival mode. I felt so overwhelmed, and the place that I'd trusted in that doctor had been betrayed. I didn't intend to hurt her. It was a physical response to a really stressful situation. Advocacy is crucial, but it's so hard to advocate when your stress levels are so high in those settings. So even now to this day, I ask medical professionals to tell me what they're going to do before they do anything. So for example, I'll say to the anaesthetist, when I go into surgery tomorrow, please tell me before you put the needle in. Please tell me before you put any of the medicine into my veins. It's really, really important. It helps me feel in control. It feels like it gives me some autonomy. And some listen to that and some don't. And that makes me furious because when you're in hospital, you lose so much dignity, so much autonomy, so much control. And asking for predictability is not asking for much. Since my autism and ADHD diagnosis, I've advocated even more clearly, not because I suddenly learned how to self-advocate. I've been doing that my whole life, but because I finally understood why it mattered to me so much. I've had a number of specialists over the years, but I've had one main specialist for many, many, many years. And he's what I call a unicorn. And I'm really sad that he is a unicorn because it shouldn't be rare to have a doctor who listens. And I mean truly listens. He trusts me. He knows that I know my body better than anybody else. If I say something is wrong, he takes it seriously. Not because I'm dramatic, not because I'm anxious or too in tune with my body, and I have had that said to me, but because he respects that lived experience matters. There was one moment about 13 years ago, and I remember that time because I was pregnant with my second child. And I was about 20 weeks pregnant with her when I had excruciating abdominal pain. My husband convinced me to go to emergency, and I remember this because it was after eating one of the best hamburgers I've ever eaten in my life. So I was very upset that didn't stay in my body. Too much information. But I remember begrudgingly going to the emergency department. And when I arrived, the first thing I said to the doctor was, I'm not taking off my shoes because I'm not staying. Because here's one of my hospital rules. Don't take off your shoes. If you take off your shoes, you'll have to stay. I know it sounds ridiculous, but these tiny rituals are what give me a sense of control in a place where control disappears as fast as anything. And the emergency doctor nodded really politely, looked at my husband, and my husband turned to him and said, "It's her choice. I haven't got any control over her." True. I asked for pain medication and said I'd be on my way. He advised me to stay. I didn't. As I left, he said, "I'll see you in about 6 hours when that pain medication wears off." I laughed and said, "No chance." Of course, around 6 hours later, there I was, crawling back in. He smiled and said, "Nice to see you. You willing to stay this time?" I agreed. Anyway, fast forward about 12 to 18 hours and things had really escalated. I don't really remember everything that happened. I was too out of it. At one point, I remember there were about 10 staff in my room and doctors and nurses and people talking really loudly over each other. And it was so overwhelming and it was so chaotic. And I felt completely lost. And then my unicorn specialist walked in and he told everyone to be quiet. He turned off the lights. He came really close to my face. It grounded me and said calmly, "What do you think is wrong?" I told him immediately what I thought was wrong. And he said, "Well then, that's how we approach it to begin with." He did follow it with, "If I'm going to listen to you, you need to listen to me, and that means you're going to intensive care." I told him, "Stop being so melodramatic." You can see I'm pretty stubborn. He smiled and he handed me my phone and said, "I need to call my husband." Apparently, I told my husband I'm going to intensive care because the doctor is being so melodramatic. And apparently the doctor took the phone back and clarified that no, he wasn't being melodramatic, that things were actually really serious. Anyway, clearly I came out the other side. But that really stays with me because that's what it looks like when a doctor truly listens, when he trusts your insight, when he makes environmental adjustments to help you feel safe, when he treats you as the expert of your own body, when he centers your autonomy, even in crisis. And I need to be clear, at that time, I didn't have my ADHD diagnosis. I'm talking about this because not all medical staff are like this. And in fact, a lot I've come across aren't. Don't get me wrong, a lot are, but some aren't. Hospitals should meet people where they're at. They should listen, adjust, slow down, explain, and honour the fact that every patient arrives with their own history, sensory needs, fears, and ways of coping. But the reality is this doesn't always happen. That's the part that hurts the most. And it's why so many of us end up having to find ways to advocate when we're scared, overwhelmed, unwell. Advocacy shouldn't be a burden placed entirely on the patient, but right now, it often is. I do want to acknowledge the phenomenal care I have had from so many medical staff over the years who've shown me compassion and curiosity and humour and genuine care, and I'm truly, truly grateful for that. Those moments of being seen and supported have stayed with me just as much as the harder experiences. This isn't about criticising individuals. It's about recognising that even with incredible people in the system itself isn't always meeting patients where they're at. There's a really important intersection here that doesn't get talked about enough, and that's the crossover between ADHD people and chronic health issues. The research is clear that neurodivergent adults, especially women, experience higher rates of chronic pain, fatigue, gastrointestinal issues, connective tissue problems, and other long-term health conditions. Australia doesn't yet publish a neat stat that captures this overlap, but the pattern is obvious in both the international research and in the lived experience of so many women. We need to really listen to what people are telling us. When we approach thinking about that intersectional lens, the quality of life and well-being improves dramatically. I'm not a mystery patient that doesn't deserve to be understood or doesn't deserve to be listened to or deserves to be dismissed. My body makes sense when you look at the big picture. So whether you're a frequent flyer in the medical system or someone who's facing maybe your first procedure, you deserve predictability, agency, dignity, connection, and a say what happens in your body. These aren't luxuries, they're basic human needs. So I'm going to think about that when I go into surgery tomorrow. Some examples of some of the things that I advocate for is I will ring the doctor and the hospital the day before to check what number I am on the surgical list. When I go in to the surgery unit, I will confirm, am I still, say, number 2 on the list? And what time is that likely to begin, understanding that that will probably change. I will also advocate for needing to know what is going to happen before it happens. I will advocate for when I walk into the theatre to take 10, 20 seconds to look around, center myself before I have to get up on that table. I will advocate for being able to undo my own gown on that table and not have someone go and do it for me without asking. I will ask the anaesthetist, tell me before you give me any medication. I will ask to use the snorkel, the breathing snorkel, instead of the oxygen mask because I find the oxygen mask overwhelming. As soon as I am in the recovery area, I will ask when I can and when it's safe, could I please have a cup of tea? Because I get very cold. It's something that warms me up and it's also very grounding for me. I will also ask for my phone because I like to let my husband know when I'm finishing. This is just a few things that I ask for. There are so many more things, but that's come from decades of experiencing this. And you shouldn't have to go through decades in order to be able to ask for these things. Please feel free to reach out. I know I'm not alone in being neurodivergent and having chronic health issues. I'm really interested to know about your experiences of advocating in different medical settings. Thanks very much.